going to be talking about medical insurance open enrollment.
Excellent. Okay.
Yes.
Take it away.
Okay. Hi, everybody. One more time, it's J.R. Gillespie with All Star Financial Insurance. And as we know, this is the time of the year when people get to think about their medical insurance. I know thinking about medical insurance isn't normally high on people's list of priorities, but it is something that can be very valuable, especially financial. So we know that we're currently in the middle of Medicare open enrollment. It began on October the 15th, and it will go through December the 7th, and it's the time of year when you can change your Medicare Advantage plan, or you could change your Medicare prescription drug plan. And you know, these changes can be significant because the plans are not the same. You know, there was a situation I just ran into with one company. A person was going to pay about $125 a month for their medications, and with another company it was going to be like $15. So you should review these things because, you know, formularies and everything change on an annual basis with all the companies. Now, Medicare is for people over the age of 65. And we have two pretty distinct medical insurance systems. We have one for people over the age of 65, and then of course we have one for people under the age of 65. And that is by and large governed by the Affordable Care Act, also known to a lot of people as Obamacare. But open enrollment for the Affordable Care Act begins on November the 1st, and it goes through December the 15th. And it works really well if your income falls below a certain threshold. So like if you're an individual and your income is below about $49,000, or if you're a couple and your income falls below about $67,000 a year, you can get some premium reductions or tax credits that will lower your monthly premiums. And this year, just like last year, Primera and Kaiser and Molina and Coordinated Care will be companies that you can enroll in if you go through the Washington Health Plan Finder. I'm a broker on the Washington Health Plan Finder. When you go up there and it says need help from a broker, you'll be able to find me if you want to attach me to your account or get assistance helping you to go through the process, compare the plans. I'm available to do that. Have been helping people pretty much since 2010, or the inception of the Affordable Care Act. And it works, like I said, if your income falls below the threshold, the Affordable Care Act is a wonderful thing. However, the people that get hammered are the people that, you know, spend the most money on their medical insurance, I like to say, are people that are 50 and above whose income exceeds the threshold, because then you're looking at some pretty significant premiums. Now, in 2019, the penalty for not having medical insurance goes away. So there will no longer be a penalty for not having medical insurance. Unfortunately, I know that will mean that a lot of people won't have medical insurance. However, not having medical insurance does not mean you will not get sick. And it does not mean you will not be injured. It just means you will not be covered. And that is really what the problem was and why they instituted the Affordable Care Act in the first place. Now, the great thing about the Affordable Care Act, it was designed to cover everything from everybody from everything, which is a good thing because, you know, I mean, medical expenses can be pretty substantial. The bad part about it, of course, is that it's very expensive to cover everybody against everything. And premiums are pretty substantial. If you're over the age of 50 and you make more income than the threshold, then you're looking at, you know, premiums that start at about $600 a month and go up from there. Now, the nice thing about 2019, and I'm going to call it the year of the Share Care Plan, they do have these things they're called Share Care Plans. They're not technically insurance, although they tend to look like a duck and quack like a duck. but they are not insurance. Now, the Affordable Care Act said, basically three things. One, it says that you have no limit on how much money you're able to spend. So there's no cap. The other thing it says is that we cannot decline you or put any limitations on your policy because of a pre-existing condition. Now, insurance companies hate having to insure pre-existing conditions. Insurance companies want to protect you against things that may happen tomorrow. They do not want to protect you from things that happened yesterday. And when you have to do pre-existing conditions, you're basically protecting somebody from something that happened yesterday. And the third thing, of course, is that they all give you a full prescription drug benefit. Now, what's nice about these share care plans is that you become a member of a community. Now, most of these communities had been Christian communities like the Medishare plan. And if you were a Christian, of course, you could go into this plan and the community would share your costs or your medical costs amongst the other members in the community. You would have to sign a document that said you agreed to the tenets of the community and those things you believed in. And if so, like I said, they would share your medical costs. Now, these plans, however, could exclude pre-existing conditions or put limitations. And of course, they had plan limitations, usually about $1 million, $2 million a year. But the good thing about them is that they just cost anywhere from 30 to 50% less because you were getting less coverage. Less coverage costs less money. And this is a situation where I think half a loaf is better than no loaf at all. If something was to happen to you, it is important to be protected. Most people don't need an unlimited benefit. Most people don't need a lot of the tenets that came with the Affordable Care Act, although if you're one of the people that needs them, it's nice that you weren't going to run out of money. But like I said, these plans will have $1 million maximum or a $2 million maximum. You may not have the same prescription drug benefit. A lot of them give you some discounts. They'll usually pay for prescriptions if you have a hospital stay, and they pay for them while you're in the hospital, maybe 3 or 6 months after you get out, but they're not designed for regular maintenance medications. In that case, you may get a discount, but you're going to pick up more of the cost of those things. But if you're in a situation where you're looking at a $600 or a $700 a month premium, you'll be able to bring that down to maybe $300, $400 a month and be pretty well protected. So those are kind of the things that we're looking at. Also, the third thing is that a lot of small businesses, and I do help small businesses with their medical insurance plans, and they'll be renewing here in January. I renewed a lot of people in December, but this is also the time of the year when they'll be renewing. And I do offer some plans. Now, all these companies would prefer to cherry pick, and like I said, if you can enroll a lot of healthy people, then you can actually get lower rates. My favorite plan, of course, will refund money to a company if their claims experience is low. And I've had companies receive as much as 30% of their premiums back at the end of the year because their people don't go to the doctor that often. These plans usually will ask that you sign or you fill out some sort of a health questionnaire. And like I said, if your claims experience is low, you can receive a refund in premium. So it's a good idea to look at this plan, in my opinion, just because there's no real downside. You can just get some of your money back, whereas with most insurance, that's not even an option. So we know that it's medical insurance open enrollment. For people over the age of 65, the dates go from October 15th until December the 7th. If you're younger than 65, the dates are November 1st until December the 15th. And then, of course, if you're a small business, there isn't really no open enrollment period. However, a lot of people have their insurances, on a calendar year basis. And then I will end at that. And of course, if you have any questions or anything that I can answer, I'm happy to do so.
So, something, because I listen when people talk, is you kept saying over 65 or under 65. What if you're 65? It sounds like it's either this or that. What happens to the person who's 60?
Well, when you turn 65, you become Medicare eligible. And so it's 65 and older for Medicare.
All right.
Yes.
Gotta say that.
Which of the share care or health share ones do you recommend the most?
Medishare is very good if you're
Medishare?
but you need to be Christian in that one. They have another one working with it's called Altura, and it looks like a pretty good plan. Now they're not saying you have to be Christian, but they do have a set of standards that have a lot of the same tenets. So they don't like things like you have to believe that marriage is between a man and a woman, and you don't have out of wedlock sex and things like that. So you're basically signing that these are things that you believe in, and if you believe in those things, then has really good rates, and seems like it's a very good plan. Yes.
You mentioned that the penalty for not having the insurance is going away in 2019. Are you seeing a lot of people dropping off as a result of that?
I haven't seen it yet, but I can imagine that a lot of people will non-renew. A lot of people that don't think, because, if you're talking $700-800 a month, are you willing to take the gamble that you won't spend, $8,000 a year in medical costs? And if you don't think you will, you might say, the only reason why I had this coverage is because, of the penalty.
Mm-hmm.
Yes.
As a small business owner, we're considering going with a high deductible and starting an HSA. How much will those premiums go down? You said because currently right now it's about $600. So if we went with a higher premium and started an HSA, what kind of deduction do you think we'd see on that monthly premium?
Well, I was looking at plans this morning, and the difference, if you have a plan with a $7,000 deductible versus a plan. Either way, you're going to spend those types of money. The biggest differences are with the HSAs is that you don't have any first dollar coverage. So if something was to happen to you and you need to go see the doctor, you're going to pay the full amount for the visit. Whereas if you have an HSA, if you have a regular account, you might have an office visit copay or copay when you see a specialist. But I don't really think you're going to see more than maybe a 10-15% difference in price for the two different plans. I like the HSAs because you're able to put your deductible into a savings account, and then you're able to deduct that from your income taxes, much like you made an IRA contribution.
Yeah, exactly. Yeah.
But the downside, of course, is that you don't have any first dollar coverage. So until you satisfy your deductible, they don't pay for anything.
Good to know. Thanks.
Anyone? Yes.
Favorite, right now I just have been experiencing Kaiser recently. And do you have a preference as far as like group health, Kaiser, Rivera, that you think is a better company as far as what they offer versus what they charge?
First of all, group health is Kaiser now.
Yeah, that's right.
And
Sorry.
actually, I kind of like Kaiser because they do that vertically integrated thing. So everything's in the same place, and you can see your doctor and get your prescriptions and your medical insurance all belong to the same organization. So you tend to get a little bit more bang for your buck. Now, like Premera Blue Cross, more doctors accept them. It is Blue Cross, so you're going to have a bigger universe of things that you can do. However, they tend to be the most expensive company. And then you have, like I said, Molina and Ambetter, who used to be big players in the Medicaid market, but with the Affordable Care Act, now they offer coverage to everyone. So usually I think the problem you have there is that there may be a little bit of intrepidation from providers because they look at it as a Medicaid plan as opposed to medical insurance.
Any
That's
feedback for JR?
Well, he's a